Hi, my name is Vin Keane with Woven Health Collective, and we're here today with Michael Linde, our Chief Scientific Officer, to discuss how omnichannel strategies can work for Med Affairs departments and teams. So, the term omnichannel gets borrowed heavily from commercial and marketing contexts. Do you think it means something fundamentally different when it's applied to medical affairs? And if so, what's lost in that translation?
I don't think omnichannel is fundamentally different between commercial marketing and medical affairs. At its core, omnichannel is about educating and reaching your audience through a deliberate plan that gets the right information in front of the right stakeholders. I think the goals differ, of course, between commercial marketing and medical affairs, and that's true of most deliverables across those two functions. And because the goals differ, you're working from different data sets and tracking different KPIs to guide the plan. You're trying to affect a different outcome with medical affairs versus commercial. But the underlying process, no, I don't see it as fundamentally different.
Medical affairs teams often sit at the intersection of science, compliance, and commercial pressure. How does that complexity affect the ability to build and execute a coherent omnichannel strategy?
I mean, everything sits at the nexus of some other components. So, medical affairs is no different from any other group in any organization. There are always outside pressures and factors you have to account for. The one thing that does add complexity here is the data. A lot of what you'd normally use to drive an omnichannel plan is either restricted or maybe fundamentally different from what you'd have on the commercial side. So I wouldn't say it makes the work more complex exactly. It's just a different way of viewing it. Everyone in some form is beholden to other interests within the organization, and medical affairs is no exception there.
There has been a lot of conversation in the field lately about HCP segmentation. I know you've spoken about this before. What does a segment actually need to look like for an MSL to find it genuinely useful when they're having a real conversation with a healthcare professional?
I think segmentation has to be meaningfully different between the segments. So if someone has a hard time figuring out which segment they're addressing, who they're talking to, then your segmentation probably isn't where it should be. There should be some clear distinction between the segments. That should be driven first by the input data, and second, to some degree, by the KPIs, channel preference, engagement metrics, the learner journey, along with other factors. If you get those right and can build genuinely distinct segments that are actually useful in the field, then it should be appropriate for the MSLs.
You work at the intersection of science, communication, and strategy. In your view, is the biggest gap in medical affairs omnichannel a technology problem, a data problem, or something else entirely?
I don't think it's a technology problem, and I don't think it's a data problem. The biggest barrier, honestly, is wrapping your head around what you're actually trying to do within the scope of the plan. People get hung up on the omni and omni-channel. How could you possibly address every channel? But it just means that all of those possibilities are on the table, and that's what you're planning for. So I think the real barrier is understanding it well enough to get started and then doing something in a coordinated way. Getting an omni-channel plan off the ground in the first place, that's to me is the biggest gap.
Yeah, I think I probably have had the same reaction in the past. How am I supposed to operate in every channel every day? Measuring impact in med affairs has always also been complicated because when we look at patient outcomes, they can be several steps removed and probably are always removed from that MSL conversation or that digital touch point. How should teams think about building a measurement framework that's scientifically credible and at the same time, useful to the business?
Well, it's a fair point. There's a rarely a direct line between the education that you deliver and the outcome you ultimately care about, which is patient outcomes. So you have to think about the measurable points in between, the ones you believe that will lead to that outcome, and measure those. Those intermediate points are where you'll have the greatest impact down the line. Over time, you can usually start to build associations between what you're doing in your omni-channel plans, which is really just educating and interacting, and how that shows up in outcomes. Improving outcomes is always the goal. That's why anybody does any of this. But the direct line measurement is and will remain a challenge.
AI is increasingly part of these conversations. Where do you see it changing the work of medical affairs, and Where do you think the hype is running ahead of the reality?
Yeah, so I'm a firm believer that AI changes everything. So when you ask where I see it changing the work of medical affairs, my answer is that fundamentally AI changes everything about how we educate HCPs, how we do it, how we understand what we're doing, how people are consuming information. I'd even argue that AI is now the most important channel we have, and it will only become more so. There's just so much data in the world, and it's been effectively impossible for a while for any human to ingest and comprehend all of that information. AI can help do that and can help simplify it for you. So I don't think the hype has outrun the reality yet. There are still things AI isn't great at. That will change over time. But in terms of what it changes, what we do today, I think the more useful question is what isn't it changing?
And you helped to moderate a webinar with the Medical Affairs Professional Society about a month ago. And that touched on the idea that the medical affairs teams already have about 60 to 70% of the data they need, but that it just hasn't been integrated yet. What does that integration work actually look like in practice? And why is it so hard to do?
Yeah, I mean, those two questions at the end are interrelated. I mean, going a level up, I think integration is just hard across the board, no matter what you're doing. And pharmaceutical companies are heavily siloed, which is often by design and necessity. So, what you really need is someone to own and drive the process, which is a challenge in itself. You're dealing with technical work and organizational structure at the same time, and you're trying to get a shared understanding of what a comprehensive view of HCP engagement even looks like, who's building it, and how. So, getting that cross functional buy in is genuinely difficult. The key when you've got the silos is to get everybody in the room and agree on who owns what, and then start stitching it together. Getting that agreement is usually the hard part.
And omnichannel models often describe a journey, right? From fragmented to integrated. And you've mentioned sort of starting and getting it off the ground. But in a heavily regulated industry like life sciences, what does it actually take to move along that maturity curve? And what tends to trip up organizations?
Yeah, I think when you talk about trying to get to an integrated state and you're talking about integrated projects, again, you need to get buy-in from the relevant parties and making sure that they're part of that conversation. That's an essential component. That means getting regulatory and compliance in the room early, and they can help you work through the components you need to move from something that is fragmented towards something that is integrated.
If you could give one piece of advice to a medical affairs leader who is genuinely committed to improving how their team communicates science to healthcare professionals, but doesn't know where to start, what might that advice be?
I mean, I think it's the same advice that you give to any daunting project. Start small. If you're committed to it, just take one manageable piece. Something achievable, and you'll learn from that process. You'll come away understanding not only what works, but what doesn't work, what you need to do to expand from there. And this is true of any large project. You break it down into components, and suddenly it becomes much easier to digest and tackle.
We've been talking with Michael Linde, the Chief Scientific Officer at Woven Health Collective, about how medical affairs teams can better use omni-channel strategies to communicate with healthcare professionals. Michael, thanks for your time today.
Yeah, thank you, Vin. It's been a pleasure.